Hello everyone, this is Dr. PriyanakaAgarwal here. Welcome to our channel Talking Tooth. So we are doing chapter 1 of Pharma, that is Introduction and Routes of Drug Administration. This video is part 3. In the previous videos we have completed question 1 and 2, that is sources of drug, enumeration of various routes along with local route of drug administration. So in this video we are starting with systemic routes. So we will be covering 4, 5 and 6 questions, that is oral route, sublingual route and transdermal route along with some other routes. Okay. So as a quick recap, let us first see what do you mean by local route and systemic route. So in local route, drug is when given, it is not absorbed into the bloodstream, so doesn't reach entire body, so it will have some local effect. Okay? In systemic route, drug is absorbed into the bloodstream, reaches the entire body via heart, so it is having action on entire body. So that's the meaning of systemic route. So systemic routes, when you see the number of routes here, so we have oral, sublingual, rectal. So these three related to GIT, inhalation, nasal related to respiratory, cutaneous related to skin, and parenteral we have intravenous, intramuscular, subcutaneous and intradermal. So we will go to each one in detail now. Okay. So yeah, so we are going to study all the routes in tabular form. So first column will describe what the route is about, second about the advantages, and third about the limitations of the particular route. Now coming to oral route. So here the drug is swallowed through oral cavity, okay, and it is the oldest and the commonest route. So what will be the advantages? It is very convenient, it is non-invasive, okay. It is non-invasive, so whenever we think about being non-invasive, definitely it will be safer. Because it is safer, medicament need not to be sterilized. It is painless, so there is no need of any assistance. It is cheaper, okay, and both liquid and solid dosage forms can be used via this route. What will be the limitations? So to understand and to remember these limitations, you have to first think about from drug point of view. So if the drug is unpalatable, means if it is not that good at taste, it will be difficult to administer and it can also induce nausea and vomiting. I am 100% sure every one of us here might have experienced this nausea and vomiting while taking the drug via oral route, right? So it can induce nausea and vomiting, and because of this reason it cannot be used for vomiting patients, and obviously it cannot be used for unconscious patient, because to swallow the drug, patient has to be in consciousness. Now after looking at from drug point of view and patient point of view, we will think about the process. So absorption will be variable because it will be affected by everything we are eating, the drugs we are taking, okay, and there will be high first pass metabolism in liver by this route. So what do you mean by this first pass metabolism in liver? So to understand that, we have to take the help of this diagram. So via the oral route, drug is going from the oral cavity and reaching to the stomach here. So when the drug is absorbed from the stomach, so first pass metabolism is the metabolism happening to a drug while passing from the site of absorption, that is the stomach, to the heart, that is the bloodstream. So it is the metabolism happening while the drug is passing from the site of absorption to the systemic blood circulation, okay. So that happens in the liver here, okay. So that is very big limitation of oral route, okay. So this is about first pass metabolism. Now let us see other points. So definitely action will be slow because of absorption being variable and high first pass metabolism, and because of this reason it cannot be used in emergencies, okay. So this is about oral route. Now coming to sublingual or buccal route. So here, as we can understand by the term, sublingual means drug is placed under the tongue. Buccal means drug is crushed in mouth and spread over the buccal mucosa. Example would be sublingual glyceryl trinitrate. So this is the drug that is used in angina, okay. Okay, so this would be the sublingual route. Drug is placed under the tongue like this. This will be the buccal route. So drug is placed over the buccal mucosa. Okay. Now coming to the advantages of sublingual or buccal route. So these 3 points, last 3 points has to be written here in opposite. Okay. So here it is variable, absorption is variable, right? Here absorption is rapid absorption, because the drug is directly absorbed into the systemic circulation. Okay. Now here it bypass first pass metabolism of liver, because drug is not reaching the stomach and not by crossing the liver. Now because of these two reasons, rapid action will be there within minutes. And one more advantage of this route is one can spit the drug when the desired effect has been obtained. Okay, so because the drug is still in the mouth, one can spit the drug. Now, so for the limitation for every route, first limitation would be irritation to that route. So irritation to buccal and sublingual route is the first limitation here, and only lipid soluble drugs can be used. Why only lipid soluble drugs? Because drug has to cross the membrane mucosa, right? So to cross that mucosa, it has to cross the cells which is made up of lipid bilayer. So drug has to be lipid soluble to cross that lipid bilayer. Okay, so only lipid soluble drugs can be used through this route. Now coming to rectal route. Okay, so rectal route means drugs are put into the rectum. So by like this, the drug is pushed into the rectum. So example would be paracetamol suppositories. So drug which are put into the rectum, they are called as suppositories. Okay. Now what will be the advantages here? So first 2 points of limitations of oral route, this has to be written here opposite here. Okay. Now because this cannot be used for unpalatable drug, but this can be used. So it can be used for unpleasant drugs. It can be used in patients having vomiting, because it has nothing to do with oral cavity. So it can be used for patients having vomitings, and as drug doesn't pass the liver, it bypass liver first pass metabolism when it is absorbed into external hemorrhoidal veins. So we have some vein name here, external hemorrhoidal veins. If you can remember this, it's okay. If you want to avoid it, no problem. Okay. Now coming to the limitations, as I said, the first limitation will be the irritation to rectal inflammation from irritant drugs, and it is very inconvenient and embarrassing. Okay. Okay, so this is about the routes related to GIT. Okay, so we have oral route, sublingual route, rectal route. So it's easy, right? So for this, remember convenient, non-invasive. So when we remember non-invasive, we will automatically remember these. Okay, and for limitations, think about drug, think about patient, and think about this process. So for sublingual, in advantages, write these last 3 points, opposites here, and first 2 points, opposites here. This irritation here, inflammation here. Okay, and just remember only lipid soluble drugs can be used here, and it is inconvenient and embarrassing for rectal route. So it's very easy, right? So this is about oral, sublingual and rectal route. Now we are moving to routes related to respiratory system. So that is inhalation. Inhalation means the drug is inhaled, okay, and absorbed from the vast surface of alveoli. So as you can see in this image, drug is inhaled. It can be through nose or through oral cavity. It will go to the lungs, okay, and it will be absorbed here through the alveoli into the blood. Okay, so this is the inhalation route. So drug is inhaled and absorbed from vast surface of alveoli. Example is general anesthetics. Now what will be the advantages? So we are going to follow the same same pattern. So whatever advantages we wrote here for the sublingual route, same things will come here. So rapid absorption, bypass liver first pass metabolism, rapid action. Okay, and as here we have controlled administration, here also we have controlled administration. Why and how? Because controlled administration with moment to moment adjustment of the dosage is possible, as the drug administered when it is discontinued, when we stop giving the drug is very rapidly eliminated from the body in expired air. Okay, So that is how we can control the administration of drug by inhalation route. Okay, so limitations, if you think about the same point here, in inflammation of respiratory tract from irritant vapors. Okay, so it's easy, right? Now coming to nasal route. So drug is absorbed from nasal mucous membrane here. So there is a difference between inhalation and nasal. Inhalation means drug is reaching the lungs. Okay, nasal means drug is absorbed through the nasal cavity. It is not reaching the lungs. So that is the difference between inhalation and nasal route. So drug is absorbed from the nasal mucous membrane. So example is desmopressin applied as nasal spray. Okay, so what is the advantage? So it is the bypass, first pass metabolism. Limitations, same point here, irritation to nasal mucous membrane by irritant drugs. Okay, so this is very simple, right? Now, so this is about inhalation and nasal route. Now coming to cutaneous route. So what do you mean by cutaneous route? So here the drug is applied on the skin. Okay, so like this, the drug is applied on the skin, and it is absorbed into the bloodstream from this skin. Okay, so that makes up the systemic route for this cutaneous route here. So drugs are applied over the skin for percutaneous absorption. Percutaneous means through the skin. Okay, so percutaneous absorption into the circulation. So same point here, bypass liver first pass metabolism and local irritation and edema at the site of application. Okay, so we have something interesting here, that is transdermal therapeutic systems. So this again is a separate question. Okay, so what do you mean by transdermal therapeutic system? I am 100% sure that every one of us have seen these patches somewhere. Okay, somewhere in our homes or somewhere in the hospitals, or okay, so these patches are nothing but transdermal therapeutic system. So these are adhesive patches, means they stick to the skin. So these are adhesive patches of various shapes and sizes. The drug is held in the, now how these patches are made. So drug is held, so this is detailed diagram of this patch. Okay, so drug here will be held in a reservoir. Can you see this green thing here? So this is the reservoir. So drug is held in the reservoir between the backing film and the rate controlling micropore membrane. So this blue thing will be the backing film, and this pink color is the rate controlling micropore membrane. Now, so below this membrane, it is under surface is smeared by an adhesive. So here we have adhesive, which is again protected by another film here. So this will be adhesive protected by another film here that we peel off. Okay, that we peel off before application. So protected by another film to be peeled off just before application. So these patches will be lasting for 1 to 3 days because of their slow and prolonged absorption. Okay, an example would be transdermal patches of glyceryl trinitrate. Again, this glyceryl trinitrate is the drug that helps in angina. Okay, now these drugs will deliver the these patches will deliver the drug at a predictable constant rate. Okay, so this is the big advantage of this this transdermal therapeutic system. Okay, they deliver the drug as the predictable constant rate irrespective of the site of application like chest, abdomen, lower back, etc. Okay, so what will be the advantages? Same point here, bypass liver first pass metabolism. Limitation would be they are expensive, local irritation and erythema at the site of application. Okay, so this is all about this video. So in the next video we will cover parenteral route. So in the parenteral route we will see intravenous, intramuscular, subcutaneous and intradermal routes. Okay, so so what did we study in this video? So we studied about oral route, sublingual route, rectal route. So this is very simple, right? Now then what did we study? We studied inhalation, nasal route. So for inhalation, in the advantages, write same as sublingual. Okay, nasal is very simple. Same thing goes with the cutaneous, what it is, same 2 points. Transdermal again, what it is and same 2 points. Simple, right? Okay, so when we go to the questions now, so questions from this topic are oral route, advantages, disadvantages. Sublingual route, advantages, disadvantages, transdermal patch or transdermal delivery system. So among these questions, these two are very important, repeated, very commonly. Okay, so I think you have clear idea about what to write for these questions. Okay, so let's meet in the next video with the parenteral route of drug administration.